I'd like to welcome everyone who has come on board for this webinar. And this webinar is about bioimaging at SAHMRI. But before I start, I'd like to acknowledge that this webinar is occurring on Kaurna land, and we acknowledge elders past and present, and also acknowledge any Aboriginal or Torres Strait Islanders who are on the webinar today. So we've been very proud of the development of bioimaging at SAHMRI, and a few people have been very important in that. One of them is Andrew Dwyer, who should really be giving this talk, but unfortunately was unavailable. So the slides I'll be presenting about human imaging are coming from Andrew, and please don't ask me anything too technical about what's on the slides because I might not be able to answer. So there we go. So if you look at SAHMRI imaging, we've always tried to develop an end-to-end imaging capability, and that is moving all the way from animal models, preclinical, using radioisotopes, to human imaging, including large animal imaging out at Pearl. And Chris Christou will be talking about the large animal imaging capability we have out at Pearl, which is actually the best large imaging capability in the country, and so we're very proud of that. If we look at the human imaging that occurs at Crick within the SAHMRI building, it's in the pod at the sort of northern end of the building, and obviously the pod, the CSIRO pod, is at the southern end. You come in the middle, and at the northern end there's the Crick pod. It's led by Andrew Dwyer. Chief technologist is Angela, and we have some experts in molecular imaging, that is Michelle Nottage, in cardiology and artificial intelligence, and that's Johan. And obviously we have Mitru supplying the radioisotopes, particularly for the molecular imaging, and Suzanne is directing Mitru. We have Kristen Burris, who's got particular skills in neuroimaging. And we also have Mark Jenkinson, who is a joint appointment between SAHMRI, Adelaide University and Oxford University, and is truly one of the world leaders in analytics associated with MRI, particularly of the brain. And we have Wick, who does a lot of the image analysis, is a physicist, but also works and runs the small animal imaging down in Bioresources. In terms of our capability, we have advanced neuroimaging capability with the 3T Skyra wideboard MRI. And this has the capability of doing a lot of neuroimaging. And you can see a picture of brainstem diffusion structural connectivity. You can see some work around the brainstem in Parkinson's disease against normal. And you can see some structural MRI with hippocampal subfield. So a lot of capacity, both in terms of the technology and also in terms of the analytics. Recently, we have, Crick has developed the functional MRI capability and is South Australia's functional MRI service in collaboration with SAMI and SA Health. And so the preoperative neurosurgical mapping for SA Health patients is conducted at Crick, and that enables those patients to have neurosurgical mapping around language, motor, visuospatial memory and connectivity. And obviously that really helps the surgeons in terms of their surgery, particularly for epilepsy. We're also part of the MRFF Frontier project, which utilises the 3T Skyra protocols for the Frontiers Australian Epilepsy Project, led out of the Florey, but we're a very an critical node of that MRFF Frontiers project. I'm not exactly sure how much it's worth, but it's about $40 million. We also have cardiac CT and cardiac MRI capacity. There's a Siemens Force CT, which has significant capability in terms of cardiac CT and coronary fractional flow measurements. And we also have the capacity for four-dimensional cardiac flow with the MRI. And so there's a lot of cardiac MRI studies going on at the Crick. In terms of oncology, one of the very new areas is the new generation ultra-small supramagnetic iron sulfide imaging. And that work started at Pearl and has now moved into Crick, and has the capacity to track lymphatic spread to regional lymph nodes. And multidisciplinary operative planning between Crick and the surgeons at the RAH allow for targeted sentinel node identification, and certainly reduce morbidity from extended neck dissection. So it's been a very exciting development, showing the importance of the continuum from preclinical to humans and then impact on patients. In terms of musculoskeletal, again, quite a lot of the work with the MRI and with the CT in terms of ultra resolution of cartilage. Arthroplastic patients can be scanned immediately preoperatively, and then the specimens taken at surgery can be used for ex vivo imaging. And so that's a very, very exciting project. And there's also another one around total hip replacements and the modeling of bone density. Both really nice collaborations with the Royal Adelaide, and obviously the closeness of SAHMRI to the Royal Adelaide makes that all possible. In terms of PET-CT molecular imaging, this is of particular excitement to us because it enables us to use the Siemens PET-CT based at Crick, but also utilize the cyclotron in our basement in terms of the manufacturing of radiopharmaceuticals. And Chris will also talk about the newly available PET-CT out at Pearl for large animal imaging. So, and we have obviously small animal capability in bioresources. So again, that flow from small animals to large animals to humans. In terms of humans, a recent project funded by Parkinson's SA and THRF using F-DOPA to look at the diagnostical impact of F-DOPA PET-CTs, and also to make them clinically available to neurologists. One area that I'm quite excited about is the national ANET cohort. So this is a national trial in regard to dementia right across the country, and utilizes amyloid and tau imaging, which enables those patients not only to get that imaging, but then to be eligible for clinical trials in terms of cognitive impairment. We all know there's been a multiplicity of clinical trials looking at their benefit in Alzheimer's and other dementia-related illnesses. None of them have been particularly good, but we do need to continue that search. And I know the patients are very keen to have available to them clinical trials that might improve their cognitive function. And the only way you can get into those trials is to be able to have amyloid and tau imaging before you go into the trial. So it's great that we've got that available in South Australia, which clearly wasn't available before. And obviously neuroinflammation is a really important issue in a number of neurological conditions, including spinal cord disease and traumatic brain injury. And G180 is one of the traces that we're developing to look at inflammation in the brain. One exciting grant that got up in South Australia through the University of Adelaide was the Parkinson's Disease and Traumatic Brain Injury grant. It was an MRFF grant that incorporated a whole lot of the things that we are co-localizing on the Adelaide Biomed site. And so it is utilizing machine learning and artificial intelligence. It's utilizing PET-CT markers of neuroinflammation. It's utilizing the skills in Parkinson's disease and TBI, or traumatic brain injury, from the University of Adelaide. It's utilising the analytics capacity that I was talking about in terms of Mark Jenkinson, world leader in neuroimaging analysis, and certainly utilising a collaboration that we've been developing over a long time with Sam Gandhi in the United States. So Lindsay leads this, but obviously pulls in all of these collaborators, and I have to congratulate Lindsay on a terrific grant utilising all sorts of aspects across the Adelaide Biomed City. This is a really interesting project as well, using high resolution CT at Crick to understand the evolution of invasive rabbits. And basically by using the CT at Crick, and because of the specimens not being able to be utilised elsewhere, we've looked really carefully at the comprehensive phenotype database of how invasive rabbits adapt to the Australian landscape and become a pest. So the other aspect of all imaging, small animal, large animal, and human, is the enormous amount of data. And we at SAHMRI have connected up with the XNAT platform, which was used for the Human Connectome project. And so we have this new data management and analyst platform available for all researchers. It takes the data directly from all of the SAHMRI instruments and clinical sites. It's secure. It's got the right pipelines for quality assurance, and also the right pipelines for image analysis. It's scalable, it's searchable and shareable, which obviously is a really important part of data in the modern clinical and modern research world. So very proud of the fact that we've been able to link with the eastern states in terms of this data analytics, and this is in part being funded by the ARDC, and also links us importantly together with the National Imaging Facility. I haven't mentioned NIF, but SAHMRI is a key partner of NIF, and NIF does fund a number of the imaging fellows, both in Crick, in the small animal imaging, and also in the large animal imaging. And we sit on the major committees of NIF and the major boards of NIF. So SAHMRI is one of the key NIF nodes, along with obviously nodes in the other capital cities, a really important aspect of that. In terms of human imaging, as I mentioned, I'm giving this talk for Andrew Dwyer. Don't call me, well, you can call me about human imaging. I'm really interested in it. But if you really want to talk to an expert, talk to Andrew or Angela, and they can talk to you about how you can get your clinical trial or your research project up and running in the Crick pod as part of the SAHMRI building. And they can also talk to you about costs and things if you want to put it into your next NHMRC or MRFF or THRF grant. And it really is a great pod, has capacity all in the one place, not available anywhere else in the state. And I think it's developed really well and links really nicely with the large animal imaging out at Pearl and the small animal imaging in bioresources. I'm going to stop there. So I'm just going to go straight on and introduce Chris Christou from Pearl, or the large animal imaging centre out at Gillis Plains. Chris is going to give his talk, and then we'll open it up for general questions about imaging right across the board. So Chris Christou is the director out at Pearl. We stole him from New South Wales, and he's been terrific since he got here. So Chris.
Thanks, Steve. Welcome, everybody. So I just want to give everyone a brief overview of what we have out here and what, as we know ourselves as Pearl, the Preclinical Imaging and Research Laboratories. When I came to South Australia and I learned about it, I find that's actually one of Adelaide's better kept secrets, unfortunately. And I think we need to get out a bit more, and people need to come out and visit us a bit more. What we do and what we can do, we're a large animal research imaging facility, and we do all sorts of animal models of human disease, any sort of research that needs done. We actually have capabilities of doing surgical workshops as well, some human training of surgical techniques in animals. And importantly, we are GLP accredited to be doing GLP studies in preclinical research in the view to progressing things onto clinical trials. And we do lots of different research here. There's many different models being used. What we have done historically and what we have currently active are things like cardiology and electrophysiology stuff. We have kidney transplants going on. We're actually in discussions now with doing some heart transplant work coming, which is exciting stuff coming up. Again, they've got a device that they're hoping to get into FDA and TGA approval for transport of hearts between patients. We've done skin healing, we've done bone healing, and we currently have a spinal fusion project about to commence. A lot of researchers have used our facility for stroke and traumatic brain injury. We have a genetically modified sheep model for Huntington's disease, which has been active for a few years now. And as you can see there, all the endocrinology, diabetes. I think something that's not really well known is our germ-free facility. We can do some non-antibiotic studies as well, looking at the effect of microbiota on things. Antibody production. I misspelled COVID, I can just see. Everyone's got, that's the word on everyone's lips and I can't even spell it correctly, but basically we are producing antibodies for a group out here, and we have done some pneumococcus style vaccine studies as well for other researchers. And we can do soil remediation studies. The PFAS study that we did in this case was actually in cattle. So we can do everything from mice through to rats, through to rabbits, through to ferrets, which we're currently doing now, all the way up to cattle. So you name it, if you need to do it, we can help you out. And basically what I can say to everybody is come out and say hello and we can show you around. Just to give you an idea, we've got some very well-equipped surgical theatres for our surgical work, but this being an imaging study, we can go on to what we have out here. We've got a 3 Tesla MR, which is the same one that Quick had for the humans. We've got a PET CT, as Steve mentioned, it's just been finished, and you can see in the bottom right-hand corner there, that's as close as I could get to the construction to show you, because it's pretty flash taking a photo on the inside. But Siemens wouldn't let me get any closer because there's proprietary stuff in there. But that's our PET CT being put in. We've got mobile C-arms, which are used in surgery, some X-rays, DEXA scanning, ultrasound, and the last one there, 4DX. I'll go into a bit more depth because that's new technology. I think that's pretty exciting going forward. And as Steve mentioned, we are a node of the National Imaging Facility, so we do get co-funding from the National Imaging Facility there. This is our new CT scanner, which I like. I like what we can get out of it. And this is an example of a spinal fusion study that we're currently doing. And you can see on the left-hand side, you can see the plate and the screws here, and that's the interbody fusion device that we're looking at, and the bone growing through it, and then a nice little 3-dimensional reconstruction of the plate and the image and the device there. Next up, we've got some historic MR images. On the left-hand side here, we're looking at blood flow through the fetus, through the heart of the sheep fetus, and just looking at the turbulence there. I think that's the sort of imaging that we can get through that. And when we're mentioning kidney study, so in the transplant side of things, they take it out of the abdomen, store it overnight, and then pop it back into the neck and see what sort of damage or how it survives in the neck. And you can see here a kidney, carotid and jugular going right through. So they're the sort of images that we can get on our CTs, on our MR through there. Our cath lab newly installed, so any cardiac work that can be done through there, passing catheters up with our fully equipped floor standing C-arm and cardiac surgery, and the sort of images you can see. This one's a really, really short video. It's 2 seconds worth of just checking where your catheter is when you're placing up through the femoral. Last is 4DX, and I think this is the exciting new technology that is out here. It's basically a software post-processing of CT images or X-ray images of the lungs. And the technology allows you to check airflow through various regions within the lungs. And that'll be developed into the vessels or anything that has fluid or air running through it. So they're the sort of images that they can post-process out of. And basically it gives you vectors and it gives you a color differentiation of what's getting well perfused with air and what's poorly perfused and the direction that perfusion's occurring. And then when they put it all together, you get images like this, a nice little 30-second video. This is, by the look at the anatomy, a rat lung, and they've processed it, they section it, and they tell you where it's breathing and where it's not breathing and the blood flow associated with those lungs. So that's exciting new technology. We can do that, anything from a mouse through to a rat. We've just done ferrets and all the way up to pigs and sheep, which we've done some scans of them as well. So yeah, there's a lot to do, there's a lot to see, and we've got a lot of capability out here with our staff. So everyone's welcome to come out and say hello.
Thank you very much, Chris. And you could see the sort of level of technology that's available out of Gilles Plains. How long does it take you to drive from SAHMRI to Gilles Plains, Chris?
If you get a good run, probably about 15 minutes.
Really not very far away, is it?
It's only 10 kilometres, so it's not far. And you don't have to sit in air-conditioned comfort. You can come out to where it rains.
Chris, where do you see the 40X going? What sort of applications in humans are they thinking about?
Look, I think it has a lot of potential. Obviously, asthma is the most obvious one. They can check airflow, they can put you on spirometers and see what your lung capacity is, but that gives you an overall picture. It doesn't really differentiate where your air's coming, where you're breathing from, which lung lobes are working, which aren't. You know, X-rays and imaging along those lines give you anatomical structures, but they don't give you airflow. I think it's great. There's, you know, if you, for example, have a tumor removed from your lungs and they have to take a lobe out, they can reassess where your flow is going to be. They can check how treatments are working. If you give a certain drug, does it dilate your airways in a certain way? Where's your, you know, where is it responding? And so I think from that perspective, it's good. Then if they start extrapolating that into blood flow as well, then it's really going to have a lot of utility for across many diseases and diagnosis. They're already looking at, you know, early diagnosis of COVID, for example. They're looking at what sort of changes could be picked up early in the disease process.
And Chris, what about the interaction with between Pearl, Crick, that is the human imaging here at SAHMRI, and the small animal imaging? I think over the last year or so, there's been a really good mix of the NIF fellows moving from site to site. Do you want to just comment about that?
Yeah, what we've tried to do, Steve, is just to integrate we had great imaging all over the place, but it was a little bit siloed in one by distance and also by staffing. So we've just tried to get everybody to work across the board and get to understand all the studies and provide input. So the role of a NIF fellow is not only just to push buttons, but it's to actually provide feedback and some expertise into studies where we understand a lot of people come into certain studies and don't know, can they use imaging? Will imaging help us, or will we get better results? And I think that's been great in helping progress things from, say, a small animal idea into a large animal and seeing how it works, and then hopefully progressing that into human imaging.
Thanks, Chris. There is a question here. Is the 40X only useful for lungs?
At present, the technology is chest related. It's flow related. So it's very early technology. It was designed by, I think Andreas's background was fluid dynamics. And he's just looking at anything that flows, be it liquid or gaseous. He's translated his technology into looking at flowing of anything. So as I said, initially they've started it with lungs, and they're trying to extrapolate that into blood vessels as well. So anything that flows in the body can be measured within reason.
Open for any other questions, but another question for you, Chris. In terms of the PET CT, the large animal PET CT, which is really a human PET CT, but used for animals, I understand that's only just been installed. Have we put an animal through it yet?
We've used the CT side of it. We haven't used the PET side of it yet. So we're waiting for someone to come up with an idea that wants to come out and use it. But yeah, we've obviously calibrated it, got the PET. We've put some radioactive isotopes in there to make sure it works. So it does, which was good because we paid for it. And yeah, the CT's been great. The PET's been a bit on the quiet side at the moment.
And the CT is a better CT than the previous one we had out there. So we won't be using the old CT anymore, is that right?
No, we've decommissioned the old one. So yeah, we went from 16 slice to 64. So the resolution's much better. The quality of the image is much better, as you saw when on those spinal fusion images that I showed you. What
are the biggest areas of growth? What's the pipeline out there look like?
Look, from my background was in orthopedics, and I still enjoy doing that. And we have had a big increase in our orthopedic studies, which has been great. I think as word gets out and I get to talk to people and meet more people out there, I think the really exciting one that's coming forward is this heart transplant one. I think working with the cardiac surgeons out there that have brought this to us is exciting. Getting that up and running and problem solving, I think, is the good part of it. It's really good being able to get in there and solve people's issues. That they come to us with an idea and we can sort of help them solve that problem. The kidney one, I think, is a great one as well. I think that's a great piece of research that's going on. But even the microbiome stuff coming out of the germ-free facility, I know it's not imaging, but there's some really good, exciting stuff coming out of that as well with regards to the effects that microbiome. I think it'd surprise everyone to know the effects the microbiome has on every organ system in the body.
Thanks for that, Chris. And so I think I might wind up here, and just, you will have seen through the two talks the vast array of imaging capability we have. And obviously, as people's research moves into a more translational space, imaging becomes incredibly important. And having the capacity to image small animals, large animals, and humans across the modalities of MRI, CT, and PET-CT, I think has been really important. So encourage people to talk to Wick down in bioresources, or to Andrew in the human imaging, or Chris in the large animal imaging when you're thinking about moving your research along that pathway. Next week, I understand Adelaide University will be presenting on prostate cancer, so I encourage you to come back next week. Thank you very much for being online today, and thanks very much, Chris, and also thanks to Andrew Dwyer for the slides. Thank you very much.